show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Health Care, where people are the heart of our business. All County Health Care is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Health Care. We are a certified home health care agency servicing Palm Beach County, Broward, Miami-Dade, and you can reach us at 954-717-7027. I am your host, Louise Gomez, and I am excited to welcome Dr. Anthony Miniaci today. And he is right here, Baptist Health Orthopedic Institute, and the number is 561-955-6784, and it's right here local, 745 Meadows Road. That is Suite 200, Boca Raton, Florida, 33486. And I read your bio. There's way too much for me to go over, so we're just going to discuss it. Thank you for coming to the show, Dr. Miniaci.
Thanks, Louise. It's really a pleasure to be here. Thanks for inviting me.
We appreciate you so much, and we know that you are an orthopedic surgeon right here locally, and we're lucky to have you because Lord knows with the population that we have, you're in demand, right?
Yeah, orthopedics is one of these specialties that everybody needs. They don't want it when they have to get it, but everybody needs it, whether they're a weekend warrior or an athlete, or as we're getting a little older, need some form of joint replacement. There's a lot of need for orthopedic surgery.
Yeah, and so let's go back to a little bit about what made you want to become a doctor and go down this route of orthopedic surgery. Tell us about your humble beginnings, if you would.
Yeah, so I was born in Canada, just outside of Toronto. My parents were immigrants from Italy.
Okay.
And so I grew up playing a lot of sports, mostly soccer.
Of course.
Of course. And so that as I grew up, you know, my parents always said, "Oh, you're going to be a doctor. You're going to be a doctor." But as I grew through, I was a sports fanatic. I loved hockey, and so what happened was I had an injury when I was playing soccer, and really shortened up my soccer career a little bit at that point in time. But I did learn a lot about medicine, and I was very intrigued with what went on. So when I went to university, I went to hang around at one of the sports medicine clinics that took care of the athletes for the team.
Right.
And I met an orthopedic surgeon who sort of took me under his wing.
This is
And
great.
before you know it, I'm applying to medical school, and in medical school I decided I want to be a surgeon and I want to be an orthopedic surgeon. So that's how, you know, from a childhood injury to understanding how they treated me to then going to university. That had such an impression on me that I wanted to do orthopedic surgery.
That's why I love hearing people's stories, because it's amazing when you go backwards and you see all the different timelines of the different events that have occurred and how you used those to your advantage because you followed your passion, sports. You were interested in learning about medicine, so it took you to where you are. So that's an amazing story.
Yeah, and I think that, you know, everybody tries to really enjoy what they do for work.
Yes.
And to be able to combine something which you love with your work is something which, you know, if that happens, you're very privileged. And I feel very privileged to have done what I've done over the years.
So have you, you've treated Olympians and professional sports athletes. Share with us a little bit about that.
Sure. So, you know, after I became an orthopedic surgeon, I did some extra training. And then as you establish your practice and what you do and some of the unique things that you do, I was fortunate enough in In Toronto at the time, I was the head of the sports medicine program there, and I was fortunate enough to help take care of the Toronto Blue Jays, Major League Baseball team.
Nice.
And because a lot of professional hockey players come from Canada,
That is true.
and many of them
Yes.
from the Toronto region, I ended up with a number of patients who actually were hockey players, some of them before they got to the NHL, some of them in the NHL. And then over the years, I sort of built my practice with that, so that that gradually built over time. And I've been very fortunate to take care of, like I said, the Toronto Blue Jays, and then in Toronto, a lot of Canadian Olympians and hockey players. And then even when I moved to Cleveland, as my position there as the head of sports medicine, I also took care of the Cleveland Browns for a number of years.
Wow.
So I've sort of
exciting.
been around the block when it comes to all of the different sports and seeing different athletes. So I've been very privileged, and it's been great.
It does. It sounds like you got the best of both worlds of what you wanted, you know, so we're happy to hear that.
Yeah, and it's been great for my family. My kids are all,
Oh, yeah.
you know, they grew up with sports, and they were able to watch them and follow them. And now I have diehard Blue Jay fans and
Oh,
diehard
that's great.
Cleveland Brown fans and stuff like
sure.
that. So it's always a lot of fun during the seasons.
I would venture to say, I could be wrong, but is hockey the highest incidence of injuries, or?
Oh, I would. They're
I
different.
don't know. It's
They're
just,
different.
It seems a little more volatile, maybe. I don't know.
Hockey's a very, you know, you got to give it to the hockey players, because they play a very intense sport,
Yeah.
and they play a lot of games.
Yeah.
So that their game is probably as intense and as physical as a
Sure.
football game. But in football, they only play like once a week. And in
Oh,
hockey, they're
true.
playing like maybe 2-3 times a week, and for an 80-game season. And then,
Yeah.
you know, another 20 or 25 games in the playoffs, depending on how far they go
Sure.
in. So it can be pretty taxing the season.
It sounds like it.
So they certainly do get a lot of injuries, but
Uh-huh.
they're pretty tough.
I'm sure. So tell us a little bit more about like the day-to-day at the Orthopedic Institute. So what type of patients are you seeing? What are the most common
Yeah.
incidences that you're seeing? And
Well, so just to go back a little bit, so I was at the Cleveland Clinic in Cleveland, Ohio.
oh, okay.
And so that Baptist Health came to me with the opportunity to build a program in South Florida. So as you know, Baptist is a very large orthopedic
Yes.
institute here in South Florida, provide very high quality care. And as if you've read my bio, you realize that I like to build things and do things, and I like innovation and creativity and all those kind of things. So the opportunity to come to South Florida was one which allowed me to help build up the orthopedic program here in Palm Beach County, to make it a leading edge clinical program, but also add the elements of research and education, so to bring in the academic piece. And then to integrate that whole program with what's going on with Baptist throughout Miami-Dade and Broward County, so that we want to put this together as all one big orthopedic program in South Florida. So that's the reason I did come.
Well, thank you for coming.
Yeah,
That's a big endeavor to
Yeah,
take
thank
on,
you.
and we're happy you came to spearhead that.
Yeah, thank you. So that obviously the first component was to get the things organized up here in Palm Beach County, and that's why I put my clinical practice here, and I'm based out of the Boca Regional. Now, for you and those that live in this region have seen all the construction going on
Yes.
at Boca Regional
I
Hospital.
have.
I know it's a little bit annoying with all that construction,
lot.
but some wonderful things are happening. So that the first building to go up was the Toby and Leon Cooperman building. And it's an outpatient surgery center, but it also has offices and x-ray facilities and stuff like that. So what we decided to do, and I was able to convince people at Baptist, was that we needed to organize orthopedics into one facility, so everybody knew where they needed to go for their orthopedic consults.
That makes sense, right?
So, and that was the first start of it. So if you come to the, or if you try and get an appointment for orthopedics in the Baptist system, the Boca Regional, the Toby and Leon Cooperman is where we're housed. And so that we have about a floor and a half of office spaces there. And it's all, you'll see when you come, it's all divided into the different subspecialty service lines in orthopedics, so that you'll have the joint replacement service, the sports medicine service, the foot and ankle people.
We have a commercial break, but I do want to continue this conversation. We'll be right back.
Absolutely.
Okay.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Thank you for tuning back to You and Your Doctor. I'm having a delightful conversation with Dr. Anthony Miniaci, and we were discussing, Dr. Miniaci, so you were mentioning that within that one building, then they have the subspecialties.
Yes.
And what else are they doing there? You said research and surgery and outpatient.
So our first goal is to put together the building, and so that's what we've done, and we've separated it all out into the service lines. The next stage is now to set up the programs within all those service lines, so that we plan on putting in there, because the building is an outpatient center, we've started doing now outpatient hip and knee replacements, and we were able to get a robot last year, and we're planning on getting another robot at the outpatient center, which really helps in terms of improving the quality of care that we're delivering to the patients. And then patients can go home the same day, so that we're really improving the quality of care for all of our patients, which is ultimately our goal, making sure that the patients get well treated and taken care of. So that once we have all that, and then the other thing that I'd like to do there is establish an upper extremity center of excellence. As you know, I'm a shoulder and elbow surgeon, and we have some very good hand surgeons and elbow surgeons, so that we have a center of excellence for upper extremity surgery as well on the second floor of that facility. And we're also planning on putting in a joint preservation and biologics treatment, so that some of the biologic treatments will be available to patients in Palm Beach County in that area as well. So once we've got all that in place, we're now in the process of planning a data collection system, so that when patients come, they'll fill out all their data forms, and we're going to collect that and then do research with that data, so that we can understand what we're doing, how well we're doing, and some of the innovative things, how well they do and how well it improves healthcare.
Following the patient to see how they are improving.
Absolutely.
Yeah.
And the final thing is then university affiliations, and we happen to be blessed with having FAU across the road from Boca, so that I've already established some connections there, and I'm doing actually some basic science research with some of the engineers over at that school. And as you know, Baptist has now also established a relationship with FIU down in the Miami area, so that we have a number of academic institutions where we can do some of that academic basic science work. We can do the clinical research in our offices and establish the data collection system, so that that's sort of the planning as we're going forward here to make this not only a program with high clinical excellence and subspecialty service, but also being contributors in the academic world.
That is what's needed, because if we're going to learn all this high-tech technology and you're
Right.
going to have all this equipment, right, we want to have well-educated doctors that are knowing what to do with the technology. Share with us a little bit about someone going in, I'm not sure if they need a replacement. What is kind of like the protocol? What is the process? There are people maybe listening now saying, I don't know, I'm scared. What do I, what would happen? Give us a scenario.
So there's a number of different ways. If you've already seen your primary care physician, or if you've seen, say, like a rheumatologist or a physiatrist or somebody else who's seen you for, say, a musculoskeletal problem, and they understand what your problem is, then they can refer you directly to that service line. So if they think that you need a joint replacement, they can refer you to somebody like that. If they think that you need a shoulder replacement, they can refer you directly to me. So that that's one of the ways.
Okay.
If you have just a problem and you don't know where to go, you can call in and see one of our primary care orthopedic sports medicine doctors. And they can start with evaluation, x-rays, and if necessary, any other further imaging, MRIs, things like that, to try and sort out what your problem is. And then if they think that it's a rehabilitation, a non-surgical problem, they'll take
Right.
care of it, including things like injections and things like that. But if they think it's a surgical problem, then they have right on the same site, actually down the hallway,
Yeah.
one of the surgical specialists that they can just refer you to those surgeons in the same facility. So
One-stop shopping. I think
one-stop
that's
shopping.
amazing.
It's fantastic.
It makes it easier for everyone, and
It's
then
great for the patients,
Yeah, it's
for
great,
sure.
and for the doctors too, because then you can share the information easier.
Well, I've done this before.
Yes.
When I set up, when I went to Cleveland 20 years ago, from Toronto to Cleveland, I helped establish a sports medicine center at the time. And what we did learn is that it was great for patients, but it was also great for doctors, just like you said, because if I had a question about something which I wasn't the expert in, but I had somebody in the hallway who was
Right.
the expert,
Right.
it was easy to just walk down the hallway and ask a question, or show them an x-ray, or show them an MRI and ask them what they think. So that collegiality actually improves patient care.
And bringing your knowledge here to South Florida with your experience of doing this before, I feel like you kind of learned what works, what doesn't work. Now, what do you get to kind of add, and what do you get to tweak? So we're having the best of that, because you experienced doing this already. So now we're going to get, I'm sure,
Well,
top notch.
So there are some benefits to getting old, and that's
Yes,
because you.
I always say that.
Absolutely.
The wisdom.
So the wisdom, and the experience
experience.
is, for sure. When you've been through things, then you know how to do them better the second time.
That's why I always say aging is underrated. We're right. We learn.
Absolutely.
We learn from our mistakes and what to do, to make
I'll
things
agree with
work.
you on that one.
Good. I'm glad. So tell us about technology coming down the pike. I always love to learn about, what do you think, like 20, 30 years from now? What could you imagine what would be so different? Like, because who would have thought robots
Right.
would have been involved in a surgery, right? No, it's like the Jetsons era, So what do you think it'll look like down the road?
Oh, for sure. I think that the robotic technology, and then remote controlled robotics, so that
Wow.
I think they're in the future sometime. I probably won't be around to see this, but you'll probably be able to do some of these surgeries remotely, as opposed to having to be there with the robots. Right now,
Wow.
the robots help us position things at the time of surgery, but I think that eventually the time will come that remote surgery will be possible.
Wow. So they'd call you and say, Dr. Miniaci, we have someone in California, and you can use your technology and do a remote surgery with that
I think that day.
I could see that.
I think that day could come.
I believe you.
You still will need, the doctors
Sure,
for the,
of course.
the hands-on and
Hands-on and being there.
understanding and talking to the patient. But I think that for some of the technical things, that I think that can get to that level, and then it becomes more consistent in terms of the delivery of care.
Mm-hmm.
I think, like everything else in this world, AI is going to blow up the whole
Yeah.
world.
Yes.
And that includes medicine. We tend to go slowly and are very conservative when we make changes, but I think
Yes.
AI is going to provide a lot of things. And already you can see that different algorithms are being developed to figure out not just, how the surgery should be done, but who the right patient is to assure a better result. And
That's an important component.
absolutely.
So
because-
now I'm looking through the lens of your perception. I never would have thought of that, but a doctor would say, is this the right patient?
Absolutely, because sometimes you think that it's the right patient and the patient needs something, but you're sort of not sure whether you should. But now you'll have proof to help you make that decision in terms of this patient should probably have this, or this patient should have this, so that helping you make those decisions, I think AI is going to contribute significantly, so that not only in just making the diagnosis, but making the decisions about different types of treatment for the patients.
Interesting. Yeah, that makes perfect sense. Makes perfect sense. So what else would you like to share about, your experiences so far, at the Institute? Any exciting stories or, great experiences that people have had? I know there's a lot of golfers here and a lot of people, maybe, they need a hip replacement or something. What is the most common thing you see?
Well, so like I said, I'm a shoulder and elbow surgeon, so that, I see mostly here in South Florida, mostly arthritis of the shoulders,
Okay.
so for replacements. But, I take care of, as you know, I take care of a lot of athletes, so
Yes.
a lot of things like shoulder instability, and like that's one of my my strengths. I do a lot of different crazy things in the shoulder, so that's one of them. So that's my own personal practice. But really, overall, my experience here has been fantastic. I think, I have been blessed. I've been with tremendous institutions my whole life. I started off at the University of Western Ontario when I trained, and then I first went into practice. Then I was a professor at the University of Toronto, which is a big academic institution in Canada. Then I was at the Cleveland Clinic in Ohio, which, as you know, has a great reputation.
Yes.
And a lot of resources and academics. And so that was wonderful for 20 years. And so to be able to come to another very well-recognized institution, which has goals of doing all of these wonderful things for patients and the delivery of this care and growing through South Florida, so that they're not interested in just sort of staying in the Miami area. To do this in all of South Florida is actually really exciting, and to be part of that has been fantastic.
Yeah, well, we're glad you're a part of that, for sure.
Thank you. Thank you.
Yes. And so as far as teaching, because you said you were a professor, so it's I see your hands in all these different arenas, so it's so good to know that you have all these different, all this different experience, because if the education component is coming as far as like FAU or FIU or all that, so you also will have good experience and knowledge as far as the education component as well.
So that's the plan. Is obviously my whole life I've had medical students and interns and residents and what we call fellows, so that post-residency people are coming to learn subspecialty training. So I've had the ability to work with those people all my life, and I would love for that to happen. We have some fellowship programs already in the South, and now with this affiliation with FIU, residencies coming. I want not only that residency, but I want a residency up here in Palm Beach County. And I think that there is that possibility to have that affiliation, have the residency program based out of FAU, and then with the Baptist system here. Those discussions are already underway, but that would be something that we would love to have. And then we also, in our subspecialty service lines, in addition to having residency programs, want to have what we call fellowship programs, so that people are learning extra at the end of their residencies. If they want to become, say, a hand surgeon, then they'll have that ability to do specialized hand surgery for a year to learn all of those special techniques.
Wow, that's very impressive. Dr. Miniaci, we actually have 2 minutes left.
Okay.
And this interview has gone by so quickly. It's been such an amazing conversation. I always love learning about, anything as far as technology and learning from your experiences. What would you like in this last minute and a half? What would you like to leave our audience with? Anything you want to share? Any takeaways?
Sure. Well, I think that especially for the people of South Florida, I think these are really exciting times. And obviously, I'm very biased, but I wouldn't have taken this job. I was in a good position in my
Sure.
career and life,
I'm sure.
but I wouldn't have taken this job if I didn't see the huge potential there is here in South Florida to build world-class care
Yes.
and world-class education and research in this area, so that we're just in its infancy. We're just starting to organize things, so that I'm happy if anybody wants to come and tour the facility, see what's happening,
love
ask
to.
questions. I'm more than happy to do that with you. So if we want to do a follow-up, that would be fantastic.
That would be great. I would love to do that.
Yeah, we can actually go to the facility and you can see what's going on there.
Yeah. So I'm going to give Dr. Miniaci's number out one more time. If anybody's listening, please reach out, 561-955-6784. He's right here at Baptist Health Orthopedic Institute. That's at 745 Meadows Road, Suite 200, Boca Raton, Florida, 33486. Thank you, everybody, for tuning in, and we will see you next week.